Hi, I'm Leisha with Hope Cancer Resources. I'm the tobacco treatment specialist, and today is Wellness Wednesday. So I wanted to talk to you guys about some of the over-the-counter nicotine replacements and a little bit of the pros and cons that each of those may have. And this may vary person to person, so this is not a all-inclusive list, just FYI. So the first one I want to talk about is patches. They come in 3 strengths and they last for 24 hours. So one of the pros is that you can put it on, it lasts all day and you're good to go. You don't really have to mess with it. And then with the strengths, that is also a positive that you can reduce down as you go, getting less and less nicotine until you're nicotine free. Another great thing around the patches is that most people tolerate these really well and don't have any issues. They work great for withdrawal management and keeping yourself out of withdrawal from the nicotine as you're quitting smoking. Some of the cons with patches is you probably will, and it's common to have some mild skin irritation. So some people do have a little bit of like redness with the skin where they put the patch, maybe some itchiness, but nothing worse than that. If you do have allergies to adhesive or latex, that can be a problem. And so in those cases, most people, it's recommended not to use the patches for those. Another thing with the patches that could be considered a con is if you'd work outside or in some place where it is hot and you're gonna sweat a lot, the patch may not stick so well. So that's one thing to keep in mind when you're considering nicotine replacements. So the second thing with over-the-counter nicotine replacements, other option would be lozenges, and I'm going to talk about the gum as well. Some of the pros and cons will be a little bit of the same, but thinking about lozenges, it does come in 2 doses, so you have 2 milligram and a 4 milligram. So this is helpful in reduction. They're very easy to use. You can kind of use 1-in-1 replacement, so 1 lozenge for 1 cigarette. As you're coming off regular cigarettes, or for smokeless, it can be great for that as well. They're fast absorbed, so putting it in, you're getting the nicotine quickly through your mouth. So that helps very well when you're in the moment and you need something kind of like now. That can be really helpful. Some of the cons with the lozenges is you need to avoid food or drink for 15 minutes before you have it in and 15 minutes after, obviously when you have it in as well. So you don't want to have any coffee, tea, things like that, or food. You can drink water, but avoiding those things is best for absorption levels through the lozenges. Also, you don't want to chew or swallow the lozenge. You really want that to just dissolve. It can take maybe 15 to 20 minutes for it to fully dissolve. Moving on to the gum, some of those are the same. The dosage is the same, so 2 milligram and 4 milligram. That same 1-to-1 ratio when it comes to either the cigarette or the smokeless. Easy to use. You can use it 4 to 5, 6 times a day, so you can kind of pace yourself throughout the day depending on what you need. Cons with the gum, one of those is the same. The food or drink thing, you still want to avoid that 15 minutes before, during, and after to help with absorption. And then the other problem that people have with the gum is if you do have dentures or any dental issues, you will want to avoid the gum. That could make it worse. And also if you have dentures, it'll stick to those, and that is difficult to use. But the other thing that people kind of get mixed up with the gum is it's supposed to be parked versus chewed. So you're not going to just sit there and mash on it with your teeth. So it needs to be kind of parked in between your teeth and your gums. And then that helps a lot with any soreness with your jaw or things like that. So obviously you can let me know if you have any questions. Also, ask your doctor if you have any questions as far as what would be best for you.